Good morning and welcome to Hot Seat. My guest is Darren Grubb, the spokesman for the Medicare Advantage Majority. Darren, good to have you.
Great to be with you. Thank you for having me, Scott.
All right, so let's start with some frequently asked questions. If anybody's watching the fire drill or the fog of war event that's happening in D.C. right now, there's a lot of discussion about a lot of topics that seniors are interested in and older Americans: Social Security, Medicaid, Medicare. We're going to talk about Medicare Advantage. So let's start. Darren, help us understand, our viewers to understand the difference between these entities and why it's important that we understand the difference in these negotiations. Let's start with Medicaid.
Yeah, Medicaid obviously is the program paid for by the federal government for seniors and others directly, and so that is in their income levels that are required to meet that. But we're representing Medicare Advantage, and so Medicaid has been the hot topic, but we are mindful that through all these discussions, as Congress and the administration are looking to cut funding to reach their budget numbers, that Medicare Advantage in particular is not cut. And so our coalition, our Medicare Advantage Majority, is a nonpartisan, nonprofit organization dedicated to protecting and strengthening the program. And here's why. More than half of all eligible beneficiaries, over 34 million seniors and people with disabilities, use Medicare Advantage. Our coalition is powered by hundreds of thousands of local advocates nationwide, including the beneficiaries, but caregivers, healthcare providers, community leaders, really the entire caregiving ecosystem. And here's kind of to your question about the difference between Medicare Advantage and regular Medicare. Now, the appeal of Medicare Advantage is that it delivers comprehensive, high quality, affordable care that goes beyond traditional fee-for-service Medicare, offering benefits like dental, vision, hearing, in-home care, things that are not available in many traditional Medicare plans. And importantly, traditional Medicare, unlike traditional Medicare, Medicare Advantage provides prescription drug coverage and caps on out-of-pocket costs. So, so seniors are very mindful of that. They want peace of mind, especially during the times that we're in with kind of a high-cost environment, high inflationary environment.
Darren, obviously the discussions about changes to Medicaid, the president says Social Security is off the table, but you're concerned enough for your organization to be reaching out at this particular time as reconciliation goes through, and a dual track. A lot of media is not covering it right now. Now we're talking about the 26 budget. The concern you have about what's happening in Washington must be heightened for your organization to be reaching out and saying people need to understand what's going on.
That's exactly right. We recently put out a survey of seniors nationwide, and we asked the question regarding the need to rein in government spending, but are you worried that posture could hurt your benefits? And the response was pretty clear. A majority of seniors said, 53% actually said that they believe the federal government should actually increase funding for Medicare Advantage, and 69% of seniors are less likely to vote for a member who supports cuts. And here's why that's important. If funding is cut, seniors are going to pay higher premiums, they're going to pay higher deductibles, they're going to pay higher out-of-pocket costs, and they're going to have less access to the doctors and services they need. And again, for our seniors out there, in a time of high inflation and rising costs, Medicare Advantage's caps on out-of-pocket expenses are important, especially for seniors on a fixed income. So we believe that seniors' message to Congress is pretty clear.
Now, there are a lot of watchdog groups, Darren, that are not connected to yours, but like the Committee for Fair and Responsible Budget, which are saying, look, the rhetoric coming out of D.C. is there's going to be reining in spending, but they're saying, for example, this is going to add billions and billions to the deficit. This thing is going to go over to the Senate no matter what the House does. Your confidence in what may or may not happen to the people that you represent, is it higher in the House or the Senate right now?
We are encouraged by what we've seen so far. I think seniors are, through our organization, through other organizations around the country, are making their voice heard. That it's important to protect and strengthen Medicare Advantage, not cut it, because of the strong benefits and comprehensive care and high quality coverage that Medicare Advantage provides. Again, it's the premier choice of beneficiaries who are at the age to decide which Medicare plan they want to be on. And like I said, over 34 million Americans have chosen Medicare Advantage.
Now, the president hasn't gotten involved in the House proceedings, and it's not at the Senate just yet. But your conversations with the administration, where do you think that Medicare Advantage fares with the administration?
Despite really high satisfaction rates and continued strong enrollment in the Medicare Advantage program, recent years have seen cuts to the program and putting the program at risk. And so, our mission is to continue to educate both beneficiaries and elected officials, and to advocate with elected officials and policymakers that it's important that they stand up for seniors and stand up for Medicare Advantage.
Give us an idea if the program receives significant cuts, because there's some rhetoric right now about everybody has to give a little, that sort of thing. So if Medicare and Medicare Advantage patients have to, quote unquote, give a little, what's the big downside to that?
The big downside, like I said, if funding is cut to this program, seniors are going to pay higher premiums. They're going to pay higher deductibles. They're going to pay higher out-of-pocket costs. They're going to have less access to the doctors and the services that they've come to rely on. That's important for a couple of reasons. It's important to the beneficiaries, but it's also important to the family members. And you take someone like me who belongs to the sandwich generation. We've got two kids at home. My wife and I have two kids at home to take care of. We also have aging parents and aging family members who need more medical care than they did even a few years ago. And they rely on us more than they did a few years ago. And so, the peace of mind that we have that Medicare Advantage for them provides that comprehensive care is significant.
Are there folks out there, Darren, that oppose what you're trying to do?
Look, it's early in the process. Again, we're encouraged by what we've seen so far. We will continue to advocate with elected officials to make sure that they know where seniors are on this issue.
And if you're talking to seniors, and they're going to be talking to their delegation here in Oklahoma, our congressional delegation, specifically the House, and then next to the Senate, what's that message?
Yeah, our message to seniors and to caregivers and to family members and others is to make sure your voice is heard during this process. And the best way to do that is at the local level. And so, I'd encourage your listeners to go to our webpage, www.medicareadvantagemajority.org, to find out how you can make your voice heard.
Darren, thanks for being with us, and we'll continue to watch what happens with our delegation and as the proceedings take place, and that's why not? I mean, it's the best entertainment in town right now. Thanks for watching Hot Seat. See this again, the entire interview at news9.com and newson6.com, and follow me at Mitchell Talks. All righty then. Thank you. Hey, Darren, you still there?
Yeah, can you hear me?
Yes.
How was that?
It was good, and we'll get it cleaned up and get it going.
All right, man. Thank you for your time today.
Thank you for your time. We'll see you soon.
Thanks.